Okay. Perfect. All right. So, again, thank you all for being here with us for our lifestyle wellness session with Tanya Beck. For those of you that are joining us via Zoom, thank you for being with us. Again, Carl, thank you for being here in person with us. Our lifestyle wellness sessions were something that we started actually prior to COVID. And found that there was a lot of desire and need within our community to hear about topics that pertain to the journey that our cancer fighters and caregivers and survivors were going through. Unfortunately, during COVID, as with everything, it all kind of went down the drain. And so our goal now is to get this program back up and running again. And so we are very happy to welcome our friend Tanya Beck here with us today from Coastal Fitness and Correction, and are looking forward to learning from you and your wisdom and knowledge in working with those going through this journey. So I will turn it over to you, and you just let me know when you want to change the screen, and I will advance it for you.
Okay, you can go ahead and advance the first one. That would be great. And I really appreciate the invite and having me here to do this presentation. So today's agenda will basically go over an introduction to myself, who I am, what my accreditations are, and what a CES or Cancer Exercise Specialist is. We're going to go over the benefits of exercise, and we're going to do some education on lymphedema awareness. And then as we go through, if you'd like to write down your questions, our very last slide will have an email address that's attached to Coastal Fitness. You can email me anytime. I'm more than happy to answer any of the questions that you might have. If you would please.
Absolutely.
Thank you. So I've been a trainer for over 20 years and specifically working in orthopedic and correction for the last 15, and really started focusing on cancer clients with cancers over the last 5 years. So after really getting to know some of the medical industry and field here locally, I decided to make it a mission to kind of help educate and inform as many people as possible on the importance of exercise through all phases of the cancer journey, even into and through survivorship, and understanding the signs of lymphedema and prevention. So what are cancer exercise specialists? A CES is an advanced qualification for personal trainers and health professionals, and it is considered the gold standard in oncology exercise education. So understanding that, what does a CES really do? We are taught to focus on each client as an individual, and with program design being just as unique as the client and the cancer journey that they're on. We measure and track each client's progress along the way, and this is something that's really interesting and a lot of people may not know, even other trainers may not know, but our services are actually and can be covered by your HSA or FSA. So while I do not take insurance myself or trainers, we can, our services can be submitted through your HSA, FSA, but you will need a letter of medical necessity from your physician. So as long as they consider it to be a part of your treatment plan, it is covered. So that was pretty exciting news for us. Mm-hmm. So we can advance and advance. So we're going to go through the benefits of exercise during cancer and when you've just been diagnosed, going through treatments, etc. So exercise during, it actually helps with muscle wasting. Muscle wasting occurs quite a bit through the medications. obviously, with what your body is going through just in the cancer alone. And so exercise, working with the CES and strength training actually helps reduce that, if not stall that completely. It also helps lower inflammation levels. So chronic inflammation is linked to cancer development and reoccurrence, and exercise has been shown to reduce the inflammation markers in the body, which can create a less favorable environment for cancer growth. It helps with anxiety and depression, with pain and fatigue, and injury during deconditioning from treatments. And it can also help with cancer recurrence. And there is a digital article available supporting this, and I'm just going to kind of touch on a few of those now. The immune system support that it gives. So a strong immune system is crucial for preventing cancer cells from growing and spreading. It helps with hormonal balance. So some types of cancer are hormone related, and physical activity can help regulate those hormone levels. Improves your cardiovascular health. So cancer treatments, not just the cancer, but cancer treatments can sometimes have an adverse effect on your cardiovascular system. So obviously engaging in physical activity helps strengthen and give you better endurance. Weight management. So because obesity has been associated with a higher risk of cancer occurrence and mortality, physical activity, again, can help improve that. Insulin sensitivity. So regular exercise improves your insulin sensitivity, reducing the insulin resistance and the levels of insulin in the body. So going back to anxiety and depression, mental health and stress reduction is a huge health benefit of the exercise. So exercise can help alleviate stress, improve mood, and enhance overall well-being. Excuse me. And then the other thing that we are going to really touch on a little bit later is the lymphatic system function. So the lymphatic system plays a role in immune function and waste removal. So physical activity can improve lymphatic circulation, assisting in the removal of toxins and waste products from the body. Now, that article actually comes from SETI, Cancer Exercise Training Institute, and there's a little bit more of it to that. So I really would love for you to request that, and we'll be more than happy to give that to you. So moving on with the health benefits, it helps improve your ability to cope with the challenges that you face during treatments and just the C word itself. Strengthen endurance, energy levels, even during your treatments. So radiation treatments are going to zap your energy levels. Chemo, the IV, medications, all of that is going to really play a big part in your energy levels. And exercise has been shown to help improve that and help improve your tolerance. So it also helps with mobility and balance. Again, when you're going through these treatments, balance can be quite affected. And so this is another way just to continue helping with mobility in your everyday life. Posture, range of motion. So posture can be affected from the surgeries that you may face or have faced. And so we help with the correction of that and improving the ranges of motion there. It also helps with your sleep quality and then just your daily life activities.
Feeling like I should exercise.
Well, how do you get there?
Exactly.
So working with a CES is extremely beneficial, and we're going to talk about design being design specific and the safety of working with a CES as you're going through this journey. Design specific, so it is for the individual. You don't just go in and they're going to pick random exercises for general fitness. We actually look at the individual based on the type of cancer that they have, the type of surgeries that they've undergone, the medications and chemo that are involved, whether it be ports or medications for hormones, and comorbidities, which is basically a fancy term for other diseases, heart disease, diabetes, etc. So there's quite a few of those to be considered. And then orthopedic disorders and injuries. So people that might have RA or lupus, or have had previous injuries like torn rotator cuffs, or these are all things that we have to consider. So I can take two individuals that might have the same cancer, and let's just do breast cancer. So we might have two people that have breast cancer. One is a man, one is a woman. Things happen a little bit differently. Men are a little different than women. And based on the type of cancer, a woman might have a reconstructive surgery to where they use her abdominals to reconstruct the breast. The man, may have a mastectomy. So both of those have to be considered and have to be trained and treated completely different. And the medications that they might be on might be different. One might have high blood pressure, the other might have diabetes. So it really is for the individual. And going into safety, you're better able to be in a controlled environment. So while gyms are wonderful, gyms can be overwhelming. There's obstacles, and if your balance is already kind of shaky, then these are other things that you don't have to negotiate when you're with a personal trainer or a CES. Virtual options for the immunosuppressed. So we do in-home virtual training via Zoom.
That's cool.
Mm-hmm. And we also are constantly monitoring the form and the physicality levels on a day-to-day basis. So one day a client might feel very strong, the next day they have a treatment, and then the next day they're feeling quite weak. So everything is tracked. Everything is monitored and then modified as they need it, right? So that brings us to tracking the progress and regress. And this is wonderful because we can then give this information to the client, or we can work with the physician directly and letting them know how they're responding to the training, how they've been going through their treatments, how it looks on paper for some. And then client education, just as we're doing today, letting them know the best things that they can be doing at home for them to be healthier, but also on lymphedema, things that people might touch on, but they really don't go into detail about. If you would please. So that brings me to lymphedema. Now, lymphedema is something that is really important to me because one of my clients who had lymph nodes radiated went back to their doctor for a follow-up, their radiologist for a follow-up, the radiologist was asking them about what their daily activities were. And he says, I start, before I exercise, I do my lymphedema exercises. And the radiologist was like, well, what's that? Why are you doing that? Who told you to do that? And so number one, my client was like, well, you radiated my lymph nodes. And so my trainer has me doing this, to prevent lymphedema. And the radiologist told my client, or said to my client, I didn't think about doing that prophylactically. So that just kind of put it on my heart to really get the word out there as much as we can, that how important it really is and the different levels that people go through. So what is it? Lymph fluid begins to accumulate in the tissue under the skin. It causes painful inflammation and limited range of motion. It can be chronic and progressive and continues to worsen over time if not treated. I cannot stress, early detection is key. So who is at risk? All cancer survivors who have had lymph nodes surgically removed, have had their lymph nodes damaged by radiation, and it can occur weeks or even years after their surgeries or radiation, and it affects the area closest to the damaged limb or where the lymph nodes were removed. So how do we prevent or manage lymphedema? So these are my top 5 ways. There are actually quite a few more, but for me, I feel like these are the top 5. So avoid tight-fitting jewelry and clothing with tight elastic bands on the affected limb that may impair circulation. So this can confuse people sometimes because they're like, but I've been told to wear a compression sleeve, or I've been told to wear compression socks. So that is actually something very different. So if you have let's just say a top, and you had lymph nodes removed as a breast cancer patient, and you have a top that might be very tight fitting along through here, it might really like dig in. Sometimes they do, and they can be a little banded. That's what we're talking about, where it can actually cut off the circulation. Or tight fitting sports bras, or for men who have had lymph nodes removed below the waist, it could be tight fitting compression shorts even. And it's not the actual short itself, it can be the banding along the leg or around the bra strap. So anything that can be really restrictive that impairs circulation. Overheating the body. So saunas, steam rooms, hot tubs, these are the things that really elevates the body's internal temperature. And again, this can be a little confusing for people because heat does feel good on a swollen limb. So there's a little bit different than applying heat versus overall body temperature and how it affects the lymphatic system. You want to keep the at-risk area meticulously clean and use lotion after showering. So an affected limb, even a paper cut that goes untreated, is a risk for infection that opens up that person to the possibility of lymphedema. So I always, with my clients, I give them a little first aid kit that they can put in their purses or their gym bags or in, wherever, whatever they're using. But it usually will have like alcohol swabs, antibiotic creams, antiseptic, and Band-Aids, just something that can be even quick, because as silly as it sounds, even bug bites can get infected. and this is Florida.
Right.
So again, that kind of goes into number 4, avoiding nicks, cuts, scrapes, bug bites. And they really recommend using electric shavers, so for underarms, legs. Traveling with the limb elevated and wearing compression stocking or sleeves. So really, if you are going to be in a vehicle for a very long time, if you are going to be flying, these are the recommendations. And then your bonus is exercise helps enhance the lymphatic flow. So going along with the prevention and maintenance for lymphedema. So what SETI recommends is that lymphatic drainage exercises be performed. You can do them in the mornings, starting out your day. You can do them, and it's recommended before you actually start your strength training. You want to think of these as almost like your warm-up. So you'll do maybe 2 to 5 minutes of cardiovascular, light cardiovascular. It could be a bike, a recumbent bike. It could just be light walking, depending on the person. Might even just be seated marching. Mm-hmm. And then you're going to start out with breathing exercises. And I'm going to touch on these, but this is available digitally, and all you have to do is just ask Kelly for it and give her your email address. But it's very detailed in how you go about. But basically what the exercises are for are to help move that lymph through the lymphatic system and get it prepared and cleared out so that you can safely exercise without building up fluid under the tissue. And again, on there, it goes into more detail, and it has a few more of the general precautions and avoidance to help. So this is the contact page. If you have questions, feel free to email me. I am more than happy to answer anything for you. And if I do not have the answer, I will find it or direct you to the person that does. The last thing that I want to go over that is in line with lymphedema is the stages. Knowing is power, gives you power over your body and to be the healthiest you. So there are 4 stages of lymphedema. Stage 0 happens deep within the tissues. It can progress very slowly. It causes sensations such as tightness, heaviness, or even diffuse tingling in the at-risk limb. So I have had clients actually describe it as running an ice cube underneath the arm, and it kind of feels that way, or the tingling. I've also had them say that it feels full under their arm, or like they're trying to hold a book, but yet there's no visible signs of the swelling, but it's obviously, it's there, it's deep in the tissue. So responding to changes in this early stage can help prevent the onset of the condition. And that just means, if you've done an activity and you're experiencing that, just kind of lay off, elevate, and relax it a little bit before you start moving into that activity again. Stage 1 is also an early stage. Swelling may come and go intermittently. When swelling is present, the skin might pit, which means if you press your finger into it, there is an indentation that stays. The elevation of the swelling limb helps provide relief and reduction in the swelling, and it is important to seek treatment. So if you're getting that intermittent swelling and you're starting to get the pitting, then you definitely want to reach out to your physician, let them know, And there might be other things that they can do for you. They might have you do lymphatic draining with a physical therapist. They might have you go for lymphatic massage. There are many different treatments that they can offer. Stage 2, the tissue now has obvious signs of stagnant swelling, and it doesn't go away. The tissue is firmer and it shows less sign of pitting. The tissue consistency starts to change and becomes a hardening of the limb, which is basically a formation of fibrosis. Seeking treatment at this stage will help reduce the limb volume and improve the tissue. The treatment will be more intensive and will require more vigilant follow-up and maintain the swelling. Stage 3, the tissue becomes very hard, and I'm not going to go into it because it can be kind of scary for some people. So again, this is a digital handout that can be requested via email. But treatment, even at stage 3, is still very beneficial and can have a remarkable impact on the tissue softening and the decongesting of the swelling. So that kind of finishes.
Wow. So this is just my own ignorance, because I'm not a cancer survivor myself, and those that I've been around have not experienced lymphedema. But when you talk about like elevating a limb, so let's say someone has lymphedema in their arm, so like are they literally just like walking around with their arm up in the air?
Well, or lying down and
With
having
it
it above their heart. Yes.
Wow.
Yes.
Interesting.
And is there a timing for that? Like how long would someone do that? Like if they have it, they can't,
As far as
at each time, like, I'm sure it's not going to totally go down without having some of these other treatments involved, but how long do you keep your arm above your head?
so usually 15 to 20 minutes. Yeah, and it does help. Even I had one client that would put her arm above her head even while she was driving. So every little bit can help, but obviously you want to give it a little while. So watch a TV show. Elevate it, watch a TV show. If you're working through your day, a lot of people do still work through their treatments.
Yes.
And so if that's the case, then yeah, just propping it up and holding it up as much as possible.
I have a question. So I don't have many symptoms or anything like that. How would if I did, how would my exercises be different based on the fact that I've had neurosurgery, I take anti-seizure medication, I have a replaced shoulder? How would my exercises different as opposed to somebody who didn't have all that going on?
Well, we would, number one, we would start to teach you. Did you have any lymph nodes removed?
I didn't.
Okay, so the lymph really wouldn't apply to you. You still can do it just for good practices, but really we would be looking at you as an individual through the treatments that you've gone through, the medications that you might be on, and we might be looking at the side effects of that and programming for that in accordance for that as well. The shoulder injury, we might start off doing something that is more of a corrective nature. So really focusing on strengthening up the connective tissue. So that way we can build a stronger support system for maybe some of the bigger moves. We might not put you into a push-up, but we might still put you into a plank.
Okay.
There goes that idea for the fundraiser.
They can be hard on the rotator.
They're hard just for everything, I think.
But
Toes, knees.
I've had clients that have had multiple tears in both shoulders be able to do assisted assisted push-ups. So, but let's be honest, that was like 14 months of corrective work before we even got to that point. So
That's awesome.
mhm.
For those of you that are on Zoom with us, if you have a question for Tanya, please feel free to unmute yourself and ask. Carl, same for you being here with us present, if you have questions too. Anyone?
You can also, not everyone is very
Absolutely,
comfortable
yes.
with speaking up. So please reach out via email. And as I said, I'm more than happy to answer those questions or find you somebody that can.
Absolutely. And as Tanya mentioned, I do have some of the digital handouts that she was talking about. And if it's easier, I can just email those out to you. Would that be okay? So I'll just plan on emailing those digital handouts to everyone who signed up, and that way they'll have them. And I'll include your contact information as well when I send that out, so that everyone will have that. So
Yeah, I had a loved one that experienced extreme lymphedema in one arm and a leg. She had lymph nodes removed because she had colon cancer, and it affected her left leg. And she was afraid to hydrate. I don't know, have you experienced that in any of your clients where they're associating, if I'm drinking fluids, that's creating the problem? And it became a fearful thing for her.
Yeah.
And yet I knew she needed to hydrate.
Right. Everyone does. But yes, I mean, everybody will have their own insecurities, their own fears, and it's really part of what we do actually is listen. We listen a lot and offer suggestions, and we try and help out in many different ways. So yes, I mean, encouraging hydration is essential, but for her, I would have been starting her with pelvic floor exercises right away. So to help strengthen that and give her a little bit more confidence too. Absolutely.
But the hydration can help with flushing the fluid as well. So it's important not to avoid that, because then it can become thicker and more stagnant. So hydration really can help to eliminate the fluid.
So as someone coming alongside someone with lymphedema, I mean, this is important to know if you're a caregiver or a loved one that's witnessing it, to have the basic knowledge that you just shared, but also understanding that you can be encouraging and say, well, this is why. So education for the caregivers is equally important.
Yes, and as CESs, we take measurements. So we really follow the swelling very closely also. But yes, and like I said, in stage 0, you can't visually see it. And so you've got your loved one telling you that there's an ice cube going up and down their arm, and you might take it for what it's worth, but sometimes we're like, oh, okay, that's interesting. And we just keep going. But yes, loved ones, caregivers, they should be aware of the signs to also help it, even in just the emotional support of it.
Absolutely. Yeah.
Absolutely. I just think when you were talking about like the tingling and and I think, gosh, all the different things that can cause that feeling, and so being aware enough to know that that's potentially something forming, in a limb, because my goodness, and just there's so many different, medications, all kinds of things that can cause that. So,
but it could just be from poor posture.
Yeah.
Because they get very, like for a person that's gone through a lumpectomy or a mastectomy, they get very rounded, they get very protected.
Yes.
Yeah, I call it self-protection, right?
Yes.
We tend to.
Exactly, when in fact, it's shortening up everything here. And so you start pinching off and getting nerve impingements. And so that could also be, but that's something that's important. I mean, you need to be aware, and if it's still continuing going and you're getting all these other symptoms that's going along with it, then you need to take notice for sure.
Yeah. So informative. Very much, very much. Well, I don't want to keep anyone else because I know it's approaching dinner time for most of us. But thank you, Tanya, for
Thank
being
you
here,
for
for
having me.
educating us, for sharing this information. I know I, for one, have learned quite a bit
Absolutely.
from this, and I look forward to being able to share this and other things
Definitely.
with our
Thank you so
community.
much.
Yeah.
Thank you so much for
Can I
coming
add
by.
one thing
Thank
before
you.
we sign off?
Yeah, absolutely.
So, I think it's important that these particular drainage exercises be done in the right order. The lymphatic system, unlike the circulatory system, does not have its own pump like the heart does for the blood vessels. So what can happen is if we start doing the exercises distally, we can create congestion.
Right.
So it's important to do proximal to distal and then back to proximal again. So first we clear those channels so that then when we drain them, they have, the
There's
channels are
pathways to
Get
clear.
back.
to
Yeah.
go.
Great
Right.
points.
Well, that speaks to going to someone that is
Knows what they're
educated,
doing.
right? Goes to someone that's educated and
Yeah,
understands.
absolutely. Yeah, the importance of having that right team surrounding you. So, absolutely.
Great information.
There is a method to the madness. And stuff like that's so important.
And
Well,
we
thank
don't-
you very much for having me.
Thank you.
Thank
Look
you.
forward to having you again.
Thank you.
Thank you. And to Kimberly and Laura, thank you for joining us on Zoom. And we look forward to seeing you all at our next session, which, just so everybody knows, we're starting a twice-a-month meditation group here at our center beginning in January. So be on the lookout for information about that coming out soon. All right.
Thank you very much.
Thank you all. Take care. Merry Christmas. Happy holidays.
Merry Christmas.
Merry Christmas.